I'm Lori Stokes. With us today are Dr. DerekEnlander, who teaches at the Mount Sinai NYU Medical School, born in Northern Ireland. He is a physician in waiting to the royal family during their New York visits. Also joining us, Lisa Behar, former principal dancer with the American Ballet Theater, and also Kate Carriger, a professional Irish step dancer. Both unfortunately suffer from chronic fatigue syndrome. We certainly welcome all three of you with us today. Lisa, let's start with you. When did you first start seeing symptoms, feeling different, knowing something was a little off?
I was 21 and a half, and I had just had foot surgery, and it was deemed a success. And right after the cast came off, I started getting these bizarre symptoms of spasms and twitches. And as a ballet dancer, I thought, oh, if it doesn't hurt, there's nothing wrong with it. And I'm 27 now, so, you know, 6 months, another 6 months, I start to get terrible one-sided head pain attacks. I don't call them headaches. And my legs started to hurt. I thought I had multiple sclerosis, and just from there, it kept getting worse and worse. I was diagnosed with fibromyalgia first, 6 years later, and then chronic fatigue syndrome, otherwise known as myalgic encephalomyelitis.
Really debilitating.
Very debilitating. Very painful, actually.
And Kate?
My problem started probably when I was 38, 39. I'd had a bad bout with the flu. I'd had a car accident. And I noticed the same twitches, muscle spasms, but worse than that, a cognitive impairment where I would feel I was in a bubble. I couldn't concentrate. I couldn't read. I was 2 steps behind everybody else. As a dancer, I had, of course, retired at that age, but my trip to Dr. Enlander encompassed every kind of physician, every kind of test. They, too, thought I had multiple sclerosis, perhaps Parkinson's disease. I went for a colonoscopy because this illness has so many symptoms attached to it.
And the battery of tests that exist. Dr. Enlander, have you found that by the time people come to you, they have gone through a series of testing, and they also have been perhaps misdiagnosed along the way?
It's a very difficult diagnosis to make because there's no specific test. In fact, it's a disease where you actually exclude other disease processes. And in the annals of internal medicine, the protocol actually for the diagnosis was that it had to be a massive fatigue of 6 months or more in duration, accompanied by 4 other of a list of supplementary symptoms. And the tests actually that are normally done in a doctor's office are invariably normal. And it's only actually when you actually probe into the symptoms of the disease that you can make the diagnosis. It's not a modern diagnosis. It was first described in London in 1955 by Professor Ramsay. Florence Nightingale was thought to have suffered from this disease after her return from the Crimea. Charles Darwin was also thought to have had this disease. So it's not a modern-day disease. It's not even an American disease.
And your particular interest in this disease really started from a childhood friend?
Yes. I'm actually, as you can tell, actually from Ireland.
Right.
And I returned to Ireland to see actually my family. And during one of these trips, a childhood friend had developed this condition, and he had to give up his job from this massive debilitating fatigue. And he said, actually, you must, Derek, go back to America and find out something about this so that you can help me, because he was in a state where he could not work.
And Lisa, that leads me really to the next question I was going to ask you. When Dr. Enlander mentions that his friend could no longer work, you say on a day-to-day basis, you really never know how you're going to feel.
Right, but you always feel wretched inside, though we look pretty normal.
You look great.
Yes, we look like we're not sick. Yeah, every day is another struggle. It's a life-altering condition, as is fibromyalgia, which are interrelated. I mean, I wake up, I don't even sleep well. A lot of us have insomnia. Ironically, you'd think that we would sleep all the time.
Right, exactly.
So I never use the word fatigue. I say weakness, this debilitating weakness, like and poisoned feeling. That's what I say.
Is it hereditary, doctor?
We don't think it's hereditary. But we have actually seen it run in certain families. So we could actually say it's familial, but not genetic.
What would be your best advice? I mean, certainly, I think in this day and age, when you do have a symptom, whether it's the flu, that you do go to the doctor, or perhaps if you are having something else, it just doesn't seem right. So many doctors are not familiar with this. So many times you almost feel like they're kind of kicking you out the door. Am I right? To some extent.
Kind of.
Yeah. There's
Yeah.
great disdain.
It's adding insult to injury is what it is.
But there is treatment.
Yes.
You just have to keep searching and be well read. I would imagine now you could also diagnose several people,
Oh,
right?
yeah, absolutely.
Yeah.
We think this is an immune system dysfunction. It's very difficult to prove because, as I said, there are no specific tests actually to pinpoint this disease. But we are led to believe actually that the immune system is dysfunctional. And that is the basis of our method of treating this disease. My nurse, who's worked with me for 17 years, and I have actually seen hundreds of patients. And Darlene, our office manager, actually, we're all very familiar with the problems that patients are facing.
But you can't necessarily be cured.
No.
You have to just have a course of medication to help you function.
Symptom by
Yeah,
symptom.
symptom management, I would
Well,
say, really.
Basically, we work as a team. Laura Wilson, my nurse, and I actually make the diagnosis in unison. We basically have got a sort of protocol to make the diagnosis, and then we have a protocol to treat the disease by an immune system adjuvant.
Well, we certainly could talk so much more about this, and I hope that at least if there are people who are feeling some of the things that you ladies have spoken about to some degree, that will lead them, spur them on to at least try to get some help. And by the way, yes, you do both look fabulous for people who
Thank you.
Thank you, yeah.
Mutual Admiration
This is a good
Society.
day, that's why.
That's right. All right, Kate and Lisa, Dr.
you.
Inlander,
Thank
thank
you.
you so
Very,
much
very
for
much.
being
Thank
with us.
you.
We appreciate it. I'm Laurie Stokes, and thank you once again for joining us. Enjoy the rest of your weekend.